Hello and welcome to Module 7 Critical Thinking Case Study. Our case study for today is Riverview Community Hospital. And this presentation is designed to be given to the board. So let's begin. The content is that there'll be a brief introduction to the hospital, there'll be a cash flow statement analysis, some key performance indicators will be examined, there'll be an interpretation of the cash flow statement, an overview of the hospital's financial position, summary of the hospital's financial position, and some recommendations. Now, some background about the hospital is that Riverside is a hospital that is known for providing quality health care to its service area. It competes with 3 other hospitals in its metropolitan statistical area. There are 2 non-for-profit hospitals and 1 for-profit. And Riverside is accredited by the Joint Commission. And that accreditation is something that they are proud of. Now, the competition is a large for-profit chain that recently purchased the for-profit hospital. The other hospitals are concerned with the chain's reputation of aggressively increasing market share. Now let's take a look at Riverview's Community Hospital's statement of cash flows. Our first one is cash flows from operating activities. And as we can see, from 2006 to 2009, the amount of money spent on operating activities decreases year after year. Next is cash flows from investing activities. Now, the fixed asset acquisition has the highest outflow in 2008 and the lowest outflow in 2009. And cash flows from financing activities. In the years 2008 and 2006, Riverside Community Hospital had the largest amount of ending cash and investment funds compared to the years 2007 and 2009. Therefore, it appears that the hospital is preparing to invest in real assets as opposed to financial assets. Next, let's take a look at the dashboard financials. You can see that the total margin is higher than the industry median. Days for cash on hand is 32.72, which is double the industry median, which is good. Now, the times interest earned is right around the industry median. Now, the fixed asset turnover is a little lower than the industry median. And total asset turnover is somewhat under the industry median as well. And the average age of plant in years is still somewhat below the industry median. Now, some key performance indicators for operating performance are profit per inpatient discharge is $79.61, which is right around what the industry median kind of looks at. Now, the net price per visit is $248, which exceeds the industry median of $139. Outpatient revenue, 26.40%, which is greater than the industry median at 21%. The occupancy rate is right around the industry standard median. Case mix index exceeds the industry median, but is fairly close. Salary per FTE is right around the median range, and employee benefits are a little bit higher. Now, economic value that's added measures the managerial performance of a company over a period of time. Now, Riverview had the highest amount of EVA in 2006. This demonstrates that there was an increase in the flow of profit, and Riverview's performance was the highest in 2006. Consequently, their lowest EVA value was during the year 2008. Now, some analysis of strengths and weaknesses are: the financial analysis shows that Riverview as a hospital is still profitable, and on average indicating that they are managing expenses well. The current ratio in days cash on hand is 25% greater than the industry median. This says that this is a positive indication that Riverview is in a position to meet its financial obligations. And the liquidity ratio is decreasing gradually, and Riverview Hospital is using current assets rather than fixed assets. There's some underutilization there. And operating indicator analysis shows that Riverview Hospital's profit margin is greater for outpatient services than inpatient services. Riverview's occupancy rate is within the median, and the hospital is maintaining its length of stay by discharging the patients on time. Outpatient visiting hours is lengthy, and it is double that of the industry average. Now, outpatient profits have improved, yet it is still negative because the hospital is seeing fewer patients on a daily basis. But let's take a look at outpatient services for a minute. To increase revenue, Riverview should increase outpatient services. In 2008, there was a $1 million profit in outpatient services. But look at the increase in less than a year. $2.7 million in profit in 2009. And you can tell by the graph, this is a dramatic growth area for potential growth for Riverview. Next, we have the summary. Now, overall, Riverview Community Hospital is in good standing. Riverview exceeds the industry in most areas, and this can be attributed to its commitment to excellent care by maintaining accreditation with the Joint Commission. Riverview can generate profits through outpatient services, primarily in profits per outpatient visit. Riverview can update its inpatient activities to the outpatient sector and implement efficient methods of running outpatient services. Since 2005, outpatient visits have been gradually increasing, yet there's still a net loss on these activities. The industry standard is around $1.6 million for profit, and Riverview is experiencing a loss here. So implementing efficient systems could achieve gains. Now the summary as we continue, Riverview's cost per visit is almost 50% higher than the industry average. Now with the number of visits increasing in outpatient services, reduction of costs in this area should be closely reviewed. Increasing outpatient services has excellent potential for Riverview, especially in order to compete with its large for-profit competitor. Most would say this is the key indicator right here. Now, Riverview has the capabilities to compete based on its continual high-quality measures. Implementation of more efficient programs can show gains in its outpatient care sector. Now, a dedicated Blue Ribbon team of administrators, patients, stakeholders can address these issues, or the board should even consider an outside source, like field experts who can recommend evidence-based objectives. So, what are some of those recommendations? Well, Riverview should continue to maintain a high-quality standard for care. It should resolve efficiency problems in the outpatient sector, and it should consider marketing its presence in the service area with innovative marketing strategies. And it should consider outside sources to help with outpatient service problems if there isn't enough expertise in the local area. And carefully consider aligning the employee benefits percentage to meet industry standards. If it's working, let's not break it, because you want to pay your good people a fair wage for the work that they are doing, especially if there's a high standard of care. Now, also allow time for newly developed outpatient services to work themselves out and be able to pinpoint exactly where the efficiencies are. And yes, there's a couple more things when it comes to recommendations before we complete the presentation. Remember that reimbursement negotiations should always be ready to be discussed. Are you paying too much? Are you being reimbursed enough? Are your costs too high? So reimbursements can be negotiated to help reduce costs in some cases. And Riverview should consider marketing insurance patient satisfaction statistics and outcomes with testimonials. Let the community know that people are happy with the care they receive at Riverview. And consider lowering overhead costs. Contracts with service providers can be negotiated to reduce costs. Consider controlling inventory. Are you buying too much of one thing? Are you buying things in groups? So consider inventory and target the community's needs. Keep experienced staff. People that live and work in the neighborhood that can spread the good word saying that they like working at Riverview, and strive to increase patient satisfaction. So overall, if needed, look for innovative, self-motivated employees. And in a nutshell, Riverview is doing a good job in many, many areas. And the bottom line is, consider increasing those outpatient services, because that's where the money is. Thank you very much. Have any questions? Thank you for listening.